Take off one sock right now. Look at the skin where the elastic sat all day. If you can see a clear groove pressed into your calf that takes 30 seconds or longer to smooth back out, that is not a sock problem. It is not a salt problem. And despite what most people over 60 have been told, it is not a heart problem either in the majority of cases. It is a drainage problem. And the system responsible is one that almost nobody has properly explained to you. Right now, fluid is sitting in the tissues around your ankle and calf. It accumulated quietly while you sat today. And tonight, when you lie down, that fluid is going to move in a way that disrupts your sleep, stresses your heart, and makes every other health problem you are managing harder. I am Dr. Robert Anderson. By the end of this video, you will understand exactly what is happening inside that swollen ankle and have a specific 5-minute routine that drains it before bed. But first, something most doctors never take time to explain: your body has two drainage networks, not one. Most people only know about the first. Blood. Arteries carry oxygenated blood out, veins carry used blood back. That system has a pump, your heart. It runs automatically every second whether you help it or not. The second network is called the lymphatic system, and here is what changes everything. It has no pump at all. Lymph is a clear pale fluid that constantly leaks out of tiny blood vessels in your tissues. It picks up cellular waste, dead bacteria, excess protein, and excess water, then returns to the bloodstream through a separate set of vessels. Your body moves roughly 2 liters of this fluid every single day, but those lymph vessels move only when you move. Every calf contraction, every ankle flex squeezes the lymph vessels and pushes fluid upward. Stop moving and the whole system stops with you. Sit for 3 hours and fluid simply sits in your ankles doing nothing. When you were 30, this was manageable. The vessels were elastic, the valves were tight. A short walk restarted the whole system in minutes. After 63, things change at once. The lymph vessels stiffen, the valves begin to leak, and the connective tissue around the ankles loses elasticity. Fluid seeps out faster and drains slower. The math stops working, and the reservoir grows. Before I continue, I need to draw a clear line. Some ankle swelling is a medical emergency. See a doctor today if one leg swells dramatically more than the other within hours and feels painful, warm, and red. That can indicate a deep vein blood clot. See a doctor if both legs swell and you are having trouble breathing, especially lying flat. Or if swelling comes with sudden weight gain of 4 or 5 pounds in 1 week and foamy urine. These need immediate medical attention. If your swelling is gradual, symmetrical, worse by evening and better by morning with no breathing trouble, what follows is for you. There are 3 distinct patterns of chronic lower leg swelling after 60. Pattern 1 is venous. Vein valves have failed and blood is pooling. You will usually see varicose veins or brownish discoloration just above the ankle. Swelling worsens after long periods of standing. Pattern 2 is lymphatic. This is what we are focused on. The swelling is soft. It leaves a pit when you press it. It often involves the top of the foot behind the toes. When lymph swelling has continued for years, the skin on the top of the foot becomes so thick you cannot pinch it between 2 fingers. That is called a positive stemmer sign, and it points clearly to the lymphatic system. Pattern 3 is cardiac or renal. The swelling comes with shortness of breath, extreme fatigue, waking multiple times to urinate, and rapid weight gain. If you have those symptoms, you need a medical workup, not a home protocol. Most people over 60 with chronic evening ankle swelling and no other symptoms fall into pattern 2. Here is what a typical day looks like for someone with this pattern. They wake up with ankles almost normal after 8 hours lying flat. They get up, have breakfast, and sit. Sit in the car, sit at a desk. Sit after lunch. By afternoon, they have been mostly still for hours. Fluid has been slowly leaking from capillaries into the tissue of the lower legs the entire time. The lymph system has barely moved. By evening, the sock groove appears. Then they lie down. All that fluid begins reabsorbing into the bloodstream. The heart receives an unexpected volume load. The kidneys shift into overdrive, producing urine. They wake up at 2 in the morning, at 4, at 5, exhausted, and the cycle starts again tomorrow. Do these 2 quick tests right now. Press your thumb firmly into the skin along the front of your shin about 4 inches above the ankle. Hold 15 seconds. Lift your thumb. If there is a visible dent that takes 10 seconds or more to smooth out, you have pitting edema. Note how deep it is. You will retest in 2 weeks and the change will be measurable. Now try to pinch the skin on the top of your foot just behind your second toe. If you can easily lift the skin into a fold, your lymph is moving reasonably well. If the skin feels fused to the foot and you cannot lift it, that is a positive stemmer sign indicating significant lymphatic congestion. 3 things most people over 60 do daily that make this worse. Hidden sodium, not the salt shaker. The sodium buried in cheese-cured meats, canned soup bread, and frozen meals. Your body holds approximately 4 cups of water for every gram of excess sodium. Most people consume twice what they think they do. Sitting after dinner. The hours between 7 and 10 at night are when the legs accumulate the most fluid. 3 hours of sitting after your largest meal creates the worst possible conditions for overnight reabsorption. Alcohol. Even 1 glass of wine dilates capillaries, increases the leak rate from vessels into tissue, and suppresses the hormone that tells your kidneys to slow urine production at night. 1 drink and your ankles will be noticeably worse by morning. Now here is the routine that addresses all of this. Morning. Before your feet hit the floor, do 30 ankle pumps while lying in bed. Point toes down, then flex them back up toward your face. 30 times, 45 seconds. This restarts lymph flow after 8 hours of stillness. During the day, every hour you are sitting, do 20 calf pumps. Heels on the floor, pump the toes upward and back down. Set a timer. This keeps the lymph system moving so fluid never accumulates to evening levels. Before dinner, take a 5-minute walk. Not a workout, just movement. Walking activates the deep calf muscles in a way seated pumps cannot. 90 minutes before bed, this is the most important part. Lie on your bed or the floor and place your legs straight up against the wall at roughly 90 degrees, heels higher than hips. Stay there for 15 minutes. During those 15 minutes, do slow ankle circles, 10 in each direction. Then place both hands on your abdomen and breathe deeply through your nose for 3 minutes. Your diaphragm sits directly behind the thoracic duct, which is the main drainage vessel of the entire lymphatic system. Every deep belly breath pumps your lymph upward. After 15 minutes, sit up slowly. Then, starting at the ankle, use the flat of your fingers to stroke upward toward the knee. Slow and gentle. Always toward the heart, never downward. 10 strokes on each leg. This is a simplified form of manual lymphatic drainage, and it physically moves fluid from tissues into lymph capillaries. After this sequence, most people feel the urge to urinate within 20 minutes. That fluid is what would have woken you at 2 in the morning. You drained it while you were awake and in control. 2 nutrition changes that directly support this system. First, drink water consistently throughout the day, tapering after 5 in the afternoon. Dehydration thickens lymph, making it sluggish. A well-hydrated body has thinner, more freely flowing lymph. Second, prioritize protein. Low blood albumin is a silent driver of tissue swelling in older adults. Albumin holds water inside your blood vessels. When levels drop, water leaks into tissue and stays there. 2 servings of quality protein daily from eggs, fish, chicken, or lentils directly improves your fluid balance physics. Your action plan for tonight. Do the PIT test now and write down your result. Before dinner, take a 5-minute walk. 90 minutes before bed, legs up the wall for 15 minutes with deep belly breathing for 3 of those minutes, then 10 upward strokes on each calf. Tomorrow morning, 30 ankle pumps before your feet touch the floor. Do this for 2 weeks. Then retest. The difference in that PIT test result is something you will actually see. Ankle swelling and lymphatic drainage are connected to something much larger than your legs. The same capillary fragility and connective tissue changes causing fluid to accumulate in your lower legs are affecting circulation in other systems as well. These share the same root mechanisms. In the next video, I am going to show you the specific daily habits that address those shared mechanisms and what the research says about reversing capillary fragility even after 65. Subscribe so you do not miss it.